Which part of the respiratory system is primarily responsible for gas exchange? Alpha, trachea, beta, bronchi, Charlie, alveoli, delta, pharynx. So here the right option is alveoli. What is the main muscle involved in breathing? Alpha, intercostal muscles, beta, abdominal muscles, Charlie, diaphragm, delta, pectoral muscles. So here the right option is diaphragm. Which of the following condition is characterized by chronic inflammation of the airways? Alpha, emphysema, beta, asthma, Charlie, pneumonia, delta, tuberculosis. So here the right option is asthma. What is the primary function of the cilia in the respiratory tract? Alpha, gas exchange? No. Beta, humidify air? No. Charlie, move mucus and trapped particles out of the airways? Yes. So here the right option is Charlie. Which gas is primarily directed by chemoreceptors to regulate breathing? Alpha, oxygen, beta, carbon dioxide, Charlie, nitrogen, delta, hydrogen. So here the right option is beta. Carbon dioxide is detected by chemoreceptors to regulate breathing. What is the primary pressure? What is the partial pressure of oxygen in the arterial blood under normal condition at sea level? Alpha, 21 millimeter of mercury, beta, 40 millimeter of mercury, Charlie, 75 millimeter of mercury, delta, 95 millimeter of mercury. So here the right option is 95 millimeter of mercury. Which of the following conditions is caused by the destruction of the alveolar walls? Alpha, chronic bronchitis, beta, emphysema, Charlie, asthma, and delta is pneumonia. So here the right option is emphysema. Which part of the brain is responsible for the controlling the rate and depth of the breathing? Alpha, cerebellum, beta, medulla oblongata, Charlie, hypothalamus, and delta is thalamus. Here the right option is medulla oblongata. What is the term for the maximum amount of the air that can be exhaled after a maximum inhalation? Alpha, tidal volume, beta, inspiratory reserve volume, Charlie, expiratory reserve volume, delta, vital capacity. So the right option is delta, vital capacity. What is the name of the condition where there is a buildup of fluid in the alveoli? Alpha, pneumonia, beta, pulmonary edema, Charlie, pleurisy, delta, tuberculosis. Comment the right answer. Which of the following best describes the Bohr effect? Hemoglobin's affinity for oxygen decreases as blood pH increases? No. Beta is hemoglobin's affinity for oxygen decreases as blood pH decreases? Yes. Here the right option is beta. Hemoglobin's affinity for oxygen decreases as blood pH decreases. Which lung volume measurement cannot be directly measured using spirometry? Alpha, tidal volume, beta, residual volume, Charlie, expiratory reserve volume, delta, inspiratory reserve volume. So here the right option is beta, residual volume. What is the primary site of resistance to airflow in the respiratory system? Alpha, trachea, beta, bronchi, Charlie, bronchioles, delta, alveoli. Here the right option is bronchioles. Which of the following is not a component of the respiratory membrane? Alpha, alveolar epithelium, beta, capillary endothelium, Charlie, interstitial space, delta, ciliated epithelium. So here the right option is delta, ciliated epithelium. What is the effect of hypoventilation on blood pH? Alpha is increased blood pH, beta is decreased blood pH, Charlie, no effect on blood pH, delta, fluctuating blood pH. So here the best suitable answer is decreased blood pH in case of hypoventilation. Which of the following condition is characterized by the presence of air in the pleural cavity? Alpha, atelectasis, beta, pneumothorax, Charlie, hemothorax, delta, pleural effusion. So presence of air in the pleural cavity is known as pleural effusion. What is the primary driving force for oxygen diffusion across the respiratory membrane? Alpha, partial pressure gradient of oxygen, partial pressure gradient of carbon dioxide, humidity gradient, delta, temperature gradient. Here the best suitable answer is alpha, partial pressure of the gradient of the oxygen. Which of the following structure is the site of gas exchange in the lungs? Alpha, bronchioles, beta, alveolar ducts, Charlie, alveolar sacs, delta, alveolar capillary membrane. Yes, delta is the most suitable answer. What is the main function of surfactant in the lungs? Increase alveolar surface tension, beta. Decrease alveolar surface tension, Charlie. Increase alveolar compliance, delta. Decrease alveolar compliance. So here the right answer is decrease alveolar surface tension. Which condition is characterized by a sudden inflammation of the airways causing difficulty in breathing? Alpha, pneumonia, beta, emphysema, Charlie. Acute bronchitis, delta is chronic bronchitis. Here the right answer is alpha, Charlie. Acute bronchitis. Which of the following factor does not affect the oxygen binding to hemoglobin? Alpha, partial pressure of oxygen, beta, temperature, Charlie, hemoglobin concentration, delta is partial pressure of carbon dioxide. Here the right answer is partial pressure of carbon dioxide. Which of the following is a common symptom of chronic obstructive pulmonary disease, COPD? Alpha, persistent cough with mucus, beta, sudden chest pain, Charlie, swelling in the legs, delta, rapid heartbeat. Here the right answer is alpha, persistent cough with mucus. Which of the following best describes the Herring-Brewer reflex? Reflex that prevents over-inflation of the lungs, beta. Reflex that stimulates coughing. Reflex that regulates breathing rate during exercise, delta. Reflex that responds to changes in blood pH. So here the right answer is alpha. A reflex that prevents over-inflation of the lungs. What is the primary function of the nasal conchae? Alpha, filter and humidify inhaled air, beta, protect the lungs from infection, Charlie, produce mucus, delta, stimulate the cough reflex. The right answer is alpha, filter and humidify inhaled air. Which of the following condition is associated with the development of the granulomas in the lungs? Here the right answer is alpha, pneumonia. What is the term for the amount of air that remains in the lungs after a maximal exhalation? Alpha, tidal volume, beta, residual volume, Charlie, vital capacity, delta, inspiratory reserve volume. So here the right answer is beta, residual volume. Which of the following is a characteristic feature of obstructive lung disease? Alpha, reduced lung volumes, beta, increased lung compliance, Charlie, decreased airway resistance, delta, increased airway resistance. So here the right option is delta, increased airway resistance. Which respiratory condition is characterized by the accumulation of fluid in the pleural space? Alpha is pneumothorax, beta is pleural effusion, Charlie is pulmonary edema, delta is atelectasis. So comment the right answer. Which respiratory disorder is most commonly caused by smoking? Alpha, asthma, beta, pneumonia, Charlie, emphysema, delta, tuberculosis. So here the right option is Charlie, emphysema. Which structure prevents food from entering the trachea during swallowing? Alpha is epiglottis, beta uvula, Charlie soft palate, delta vocal cords. Here the right option is alpha, epiglottis. What is the effect of hyperventilation on partial pressure of carbon dioxide in the blood? Increase in partial pressure of carbon dioxide, decrease in partial pressure of carbon dioxide, Charlie, no effect on partial pressure of carbon dioxide, delta is fluctuation in partial pressure of carbon dioxide. So in case of hyperventilation, there is decrease in the partial pressure of carbon dioxide. The right answer is beta. Which of the following is the primary symptom of acute respiratory distress syndrome? Alpha, shortness of breath, beta, chronic cough, Charlie, chest pain, delta, frequent infections. So in this case, the right option is alpha, shortness of breath. What is the term for movement of air in and out of the lungs? Alpha, respiration, beta, ventilation, Charlie, perfusion, delta, diffusion. So the most suitable answer is beta, ventilation. Which of the following condition is characterized by inflammation of the bronchi? Alpha is emphysema, beta, asthma, Charlie, chronic bronchitis, delta, pleural effusion. So here the right answer is Charlie, chronic bronchitis. Itis stands for inflammation. Which lung condition involves the collapse of all part or all of the lung? Alpha, pulmonary edema. Beta, pneumothorax. Charlie, atelectasis. Delta, hemothorax. So in this case, the right option is atelectasis. So the right answer in case of 35 is atelectasis. What is the term for low oxygen level in the blood? Alpha, hypoxia. Beta, hyperoxia. Charlie, hypoxemia. Delta, hypercapnia. So low oxygen level in the blood. The best suitable answer is Charlie, hypoxemia.